The next bill we have is House File 4818. And I'm losing my voice here. And Representative Murberg, this is going to the General Register if you want to make your motion.
Thank you, Mr. Chair. I move that House File 4818 be sent to the General Register.
And members, we've had a lot of discussion on this. We had testimony. We're here to do the amendments and discuss the bill then. So now that the bill's in front of us, I have a handful of amendments here, and I'll start with the A3. And who has the A3 amendment?
That would be me, Mr. Chair.
Representative Schultz.
Thank you, Mr. Chair. I'll just mention, just kind of to your last point, you know, last time we were here discussing this bill, it was only testimony that we took. There wasn't any member discussion so far. And I know that there's plenty of concerns and questions. And I know, frankly, a lot of the folks in attendance here have concerns with this bill and certainly can continue to offer their voice. I move the A3 amendment, and this just says that instead of just kind of picking one spot in the state of Minnesota where standards like this would apply, that they would then apply statewide. It would include the state of Minnesota and vendors of the state of Minnesota, and whenever a state vendor requests or goes through the RFP process.
And Representative Berg, what is your pleasure with the A3 amendment?
Thank you, Mr. Chair, and thank you, Representative Schultz, for your amendment. I'm going to recommend that we have a no vote on the amendment.
Representative Schultz.
Thank you, Mr. Chair. I guess I wanted to ask the chair, or not the chair, but the author of the bill, why this should apply differently to the MAC versus the rest of the state of Minnesota.
Representative Berg.
Thank you, Mr. Chair, and thank you, Representative Schultz. So what we're finding out about the airport workers, and I've said before, they are the ones that make my job possible. They are often low-wage or immigrant workers, and this is just one more way that our workers are being taken advantage of. And so right now, this bill focuses on those particular workers at that particular location, and nobody is happier than I would be to address it for all workers in every situation across the state. So if you want to work on that with me, that would be awesome.
Representative Schultz.
Thank you, Mr. Chair. I just want to just kind of point out the irony that it's only this one particular location, despite the challenges that we've heard even today about immigrant workers across the entire state facing challenges like this. If this is truly about the immigrant workers, it's also targeting small employers. So I'm just I brought forward this amendment to kind of gain an understanding as to why we wouldn't hold the state of Minnesota to the exact same standard that is put forward in this underlying bill.
And with that, members, all in favor of the A3 amendment, please say aye. Aye. Opposed?
No.
The motion does not pass, does not prevail.
Not loud enough. I know to hear what says to me.
The A3 is not adopted. I have the A4 amendment.
Thank you, Mr. Chair. That would be me again.
Representative Schultz.
Thank you, Mr. Chair. The A4 amendment says that while we were unable to take on the entire state government and hold them to the same standards of this bill, this says, well, there's a lot of these same workers who work at colleges and universities in Minnesota, and we should include them. So that is the A4 amendment.
And Representative Berg, what is your pleasure with the amendment to your bill?
Thank you, thank you, Chair and Representative Schultz. I'm once again going to recommend a no vote on this. And I love what you said about, you know, the last bill, it addressed immigrant workers. This bill addressed immigrant workers. Right. So I'm excited that we can just make sure that we're introducing legislation that covers all of our workers in the various different industries with the things that are particular to that industry, the challenges and the barriers that they're experiencing. So I'm going to recommend a no vote on this.
Representative Schultz.
Thank you, Mr. Chair. I guess I'm kind of concerned on the general path that we're on here. My priority sitting around this table is to prioritize and to help Minnesota workers, Minnesotans themselves, and you know, certainly if a bill's going to come forward like this and you know, target one particular area, that it should have a more full-throated support across the state. And so at this time, Mr. Chair, realizing the lateness of the hour in this committee, I'm going to withdraw the 8-4 amendment.
Representative Schultz withdraws the A4 amendment. I have an A5 amendment.
Mr. Chair, I'm withdrawing that A5 amendment.
Representative McDonald withdraws the A5 amendment. I have an A6 amendment.
Mr. Chair, thank you. I have the A6 amendment. Representative Berg, this would apply to other airports within the state, and it doesn't just target one area, one major hub, one airport that has received, what, 6 or 7 top airports in the nation, including 6 in a row, which include all kinds of things such as cleanliness and customer service and cost of goods and employee satisfaction. So we have a really good thing going at our Minneapolis airport. I am blessed by the good Lord to fly quite often photographically when I'm not here at the Capitol. So I do get there often and enjoy the airport quite a bit. But I think it should be fair that if it's one airport, it should be, there'd be no reason why not to do other airports. I don't see any logic in it. So I'm just would like to offer this. Representative Berg includes the St. Paul Regional Airport and Duluth International Airport and the St. Paul Downtown Airport, home and field. And I said St. Cloud, didn't I? And just includes all the airports, so we're not just targeting MSP.
So you, Representative McDonald, you're moving the A6 amendment?
I am moving the A6 amendment.
Thank you, Representative. And Representative McDonald, I'm a little taken back. You're not going after Crystal Airport, which isn't part of my district, but anyway.
Mr. Chair, I know that I flew out of there just a couple of months ago with the CAP, so I will leave them alone.
Yeah. Representative Burr, what's your pleasure with the amendment?
Thank you, Mr. Chair, and thank you, Representative McDonald. I can't believe we haven't crossed paths. I am just awaiting the day you end up on one of my flights. That's going to be really fun. Mr. Chair, to maybe say a couple of words about this amendment, I would call upon Ms. Diaz. We can maybe get a little information on that.
Welcome to the committee. State your name for the record and proceed.
Good afternoon, Mr. Chair, Representative. My name is Samantha Diaz. I'm the Political Director of SEIU Local 26. We represent about 1,300 passenger service workers at the airport, and about roughly 200 of those workers are janitors. We've been working closely with our partners at Unite Here, who have around 1,200 workers at the airport, at MSP specifically, and the Teamsters Local 120 with a couple hundred members. For us, there is an acuteness at MSP specifically, and so that's why this particular, the legislation is geared for MSP.
Representative McDonald.
Mr. Chair, in lieu of my amendment, which I think is a bad amendment, actually, same here with the bill. I don't think that the bill would be good for MSP or for all employers and even the employees. So I withdraw this amendment.
And Mr. Chair, if I just may address that, thank you so much. The reason that we focused on MSP only is because those workers do typically make a higher wage than at some of the regional airports that you put forth in this amendment. And let's not confuse the fact that just because they make a little higher wage that they're okay. What that means is oftentimes they lose that medical assistance because they just come in on the cusp, so they neither can afford medical care, and then they lose any assistance that they might have. So they're just basically left with no option. And that's why this bill is about getting an employer contribution for them to be able to buy into the employer-based health plan. If they choose not to do that, they do not get the dollar amount we've outlined. So I hope that just clarifies if you have any further amendments you're considering.
Representative McDonald?
Mr. Chair, thank you, Representative Berg. It doesn't clarify anything because the Affordable Care Act, also known as Obamacare, that came out many years ago, was supposed to be the end-all answer to all of this affordable care, health care. And it seems to be failing because of you need another bill that'll tack on another $4 and, what is it, 88 cents per hour per employee on everybody at the MSP, including the gas station that's just adjacent to that. So it's not clear at all that because with the Affordable Care Act and healthcare was supposed to be affordable, that this bill is even needed. I'm not clear on that. And I have to say that the cost of things at the airport is already significant for those who fly, and Representative Berg, you do. The cost of a donut to a cup of coffee to a piece of candy bar, very expensive. A gin and tonic is almost $10. Double is $12.50, or maybe $14. Not that I know, I remember. An Irish beer is too expensive. It's $2.50 in Delano on happy hour. So the cost is significant, and that, if you remember, one of the Delta or MAC testifiers testified that if they very could lose being a hub, a major hub, because of the cost is a consideration. And surely because you work there and that is your profession and your love and vocation, you don't want to harm that either. Mm-hmm. And many those employees have really good health care already. For those who don't, we have a federal program, the ACA, that takes care of those who are in your level that you had mentioned. Mm-hmm. That is why that Affordable Care Act was initiated in the first place. Mm-hmm. So your bill will increase the cost significantly and could damage the hub that we have at Minneapolis Airport and the beauty that it is, from what I hear from testifiers and my own personal opinion and others here as well.
Representative Hussein, you had a question.
May I respond, Chair? I will. Thank you for that. I think that we've grown comfortable with the narrative that everything is expensive because we're paying workers, and that's just patently false. There is nothing in this bill that is going to threaten MSP being a Delta hub or having any other airlines that come and participate. It makes way too much money. It is a fabulous location for where Delta, American, United, where they all want to go. None of that is in danger because we want to allow people that are going to push your loved one in a wheelchair from one plane to another if they have health care. None of that is under threat. So that is a narrative that is far too easy and far too simple. And I hope we're better thinkers than that.
Representative Hussein.
We have Jimmy coming next.
Thank you for bringing this bill forward. And Samantha Diaz, I have a question for you. What's the percentage of immigrants that are working at the airport? Do you know?
Ms. Diaz.
Mr. Chair, Representative, that is a good question. I know for our local, just in general, we represent 8,000 janitors, security officers, airport service workers at the at MSP. So largely Black, brown immigrant workers, largely Latino and East African of our 8,000 membership.
Representative Hussein.
Thank you. And the reason I ask is the majority of people that does the cleaning and do the labor work are people of color and immigrant, correct?
Mr. Chair, Representative, yes, largely overwhelming majority immigrant.
Thank you. And the reason I'm asking is that the backbone in our country has a rich history because the backbone in immigrant that has been built and uplift for many aspects. And I am proud to support this bill, and thanks for bringing forward Good Airport Act. It's good workers that deserve living wage, affordable health care, and a voice at the job in the union. Our people deserve to feel safe and respected in their workplace. The many reasons that we are seeing and have a #1 clean airport and atop the nation is because those people that have been working so hard to do cleanings, or if someone that need to get to wheelchair, like my dad utilized, and he's 86 years old. And every time he's trying to travel, he travel alone because he has accessibility for those people that speak multiple language, for those people that get to his gate and where he need to be at. So I am fighting, and I want to make sure that these people get what they deserve and make sure they're treated with respect. Thank you very much.
Representative Myers.
Thank you, Chair. Thank you, Representative Berg. Just a few questions. So we know that businesses at the MAC are restricted on what they can charge. And I'm just wondering if from, your research, have any studies been done that show that these businesses are going to be able to absorb this cost, given a lot of them are still digging out from the pandemic?
Representative Berg.
Thank you, Mr. Chair, and thank you, Representative Schultz. I'll defer to Ms. Diaz.
Ms. Diaz.
Mr. Chair, Representative, thank you for the question. Just the airline industry is a heavily subsidized industry, just period. They've received billions of dollars in COVID relief money, and just recently there was a $150 million investment to bring Sun Country to MSP. So there's no shortage of money available, and what these corporations are making on their bottom line. So just to paint the context of the issue around healthcare, only 30% of employees at MSP accept employer-provided health insurance. What that looks like for our members, 80% of the folks that have insurance get it from like MNsure or government subsidized programs. So we are talking about billions investment from an airline industry, and then it's a twofer in that our employees are still forced to either not accept insurance or go through government subsidized healthcare.
Representative Myers.
Thank you. Could you, for the testifier, repeat again, because it leads to a different question I have, and the answer provided, I think, was for some of the larger corporations. I mean, I've got a couple, female business owners that run operations in the MAC and are deeply concerned about being able to, the position they've been put in and what they've done to cover previous, employees or businesses that have shut down and taken those employees on, that now, that this is going to put another burden on them. And the question that I had was, what percentage of people, and I think maybe you said it, but just to clarify, are not taking the insurance, and if you guys have studied this, and where they're getting their insurance from, if it's a family member or MNsure, I'd love to know what those percentages are.
Ms. Diaz, shortly, quickly.
Yep, Mr. Chair, Representative. So the MAC's survey that we've received through a FOIA request, they, in the survey of their employers at the airport, only 30% of employees accept employer-provided health insurance. Our own data of our membership of our between Unite Here and Local 26, it was reported, the survey revealed that 80% of our workers at the airport have insurance through government subsidized healthcare.
Representative Myers.
And thank you for that. And so hopefully, you can work with, we heard some testimony before that they've, Delta, other agencies have done a lot of research in finding out, what benefits are most important to people and taking your information, that information, and trying to, figure something out. The MAC has kind of been at the forefront of some of these labor standards. First time implementing $15 an hour, paid sick leave, worker retention, and it was brought up here before. I'm kind of confused why we're targeting them when they've kind of been at the forefront of trying to address some of these things. The final question I would have is, from the implementation of this, is there any concern that these owners and operators in these businesses will now pick and choose to reduce other benefits to cover this? Have there been any studies or surveys that you guys have completed?
Ms. Diaz.
Mr. Chair, Representative, so to the last portion of your question, for our employers, they for Local 26 employers, they pay about $3.02 per hour towards health insurance. That's assuming 40 hours. What we are talking about in this bill, the intent is to close that gap from the SEA peg of $4.98, and so cover that difference. in the effort to ensure that our members have the ability to accept health insurance.
Representative Myers.
Yep, and my final point is just, I think we really have to think long and hard when we look at the operations of these bills, and when you start dictating benefits on employees, on employers. What I've heard too many times from, employees that I talk to in my district are now they're afraid that you're going to, they're going to get a piece of paper that says, here's the benefits that the state says that we have to give you, and you're going to lose other benefits that may be more important to those employees. So, I'm just hopeful that we can, make sure that we're balancing that out.
Representative Mecklen.
Thank you, Mr. Chair. Representative Berg, or perhaps your testifier, why wouldn't the union just negotiate this that represents all these employees? I've kind of heard conflicting things, so I'm not sure that I'm understanding.
Representative Berg.
Thank you. I will let Ms. Diaz answer that.
Ms. Diaz.
Mr. Chair, Representative, thank you for the question. We are currently in, Local 26 specifically is currently in bargaining with our passenger and service employer. In terms of why the MAG, it is incumbent on the MAG to protect its proprietary interest in ensuring a good, strong workforce with low turnover. And this is an opportunity for them to do that, given that this has been an issue that we've been talking to them with over for nearly 3 years with no solution.
Representative Mecklen. I've got 2 more people on the list that want.
All right, go ahead. I'll let it ride. I do have to get to another committee, too.
Representative Schultz.
Thank you. I just actually wanted to kind of point out that I think that there's maybe an air of bipartisanship that we can get to here. We're dealing with workforce challenges and the crisis there. And this before us and a lot of the bills that we've seen here have just been, frankly, a government forward solution, more government intervention to the challenges that we face. And I really feel like it might be incumbent upon us to just reduce a few of those barriers, allow the private sector to grow a little bit, and then focus upon our tax policy. Because our challenge here, the reason that we're having these issues with medical assistance is we have a broken system that says that families who want to work hard in our state, they are disincentivized from working hard because then they'll be taken off medical assistance. And this is something that I know that there's a DFL senator who has a bill to work on this issue. And I just think that if we're going to continue down this path, the solution is providing the appropriate medical assistance and tax strategies so that we're not kicking people off of their health insurance. And that there is a tiered approach that allows for people to work harder and fill the many jobs that we have available rather than a new mandate on one particular area of the state.
Representative McDonald.
Mr. Chairman, at your discretion and with your permission and leniency, I would like to call down the MAC gentleman who testified last time, I believe he's in the room, and just have him just kind of answer some of our questions regarding are other hubs, Midwest hubs, doing this, such as Detroit, Chicago Midway, O'Hara, and if it's such a good idea here, why not in other hubs? And my concern was, as he testified a week and a half ago, that this would affect potential Minneapolis as a hub. So I was wondering, Mr.
If he can answer quickly, and if we can ask shorter sentence questions so that we're not taking 5 minutes on a question for a yes or no answer.
Mr. Chair, my question was 30 seconds, so I appreciate that.
Welcome to the committee. State your name for the record.
Chairman Nelson and committee members, thank you. Mitch Killian, Governmental Affairs with the Metropolitan Airports Commission. One thing I hope that you recognize from this conversation is there's a lot more in-depth conversation that needs to happen. And this bill didn't go to transportation, didn't go to local government, and now it's just going to the general register. So there are a lot of things we would like to react to that were testified to here, and we hope we get the chance to somewhere. To your question, No, none of the Midwest airports have anything like this. None of the Delta hubs, not Chicago, not Dallas. And you can look and find some weird nuances on the coast, San Francisco and New York, that have something, but not like this exactly, and that someone's going to point to, and 1 out of 30 hubs or a couple out of 30 hubs have something, but none of the Midwest airports that we compete against for traffic, including Delta's connecting traffic, have policies like this.
Representative McDonald.
Well, thank you, Mr. Killian. These policies are detrimental to the success of our airline, our hub. Furthermore, just because we have recognized on this side that the damage this could provide, and the fact that there is health care to those who work there already, SEIU has a federal, I think they have also a national welfare fund that helps every employee there. So to indicate they don't have it is false. But our concern is that, A, it's not needed because they have health care, and why they aren't accepting it, that's the bigger question. And as Mr. Killian said, this must go to other committees to be ironed out, these differences. I mean, you're looking at the gentleman that basically has your livelihood. And those from Delta and MAC and other areas are telling you, including a lady who testified 2 weeks ago that has many small businesses of independent women and BIPAC people and women who have businesses there, that this will affect greatly. And yet you ignore what they say. I don't see how you can just cram this through and go bring it to the national, or to the register, general register, without listening to grave concerns of people that are moving our state. And just to indicate that we don't appreciate or are thankful for those who are pushing our grandparents and our children and cleaning and doing all the work is false. And I see when you look at us saying, well, you insinuate that we don't care. We do care. We do care. And we're thankful of the good work that they do. But we also have to be concerned with those who are saying this is detrimental and costly, and it's certainly not ready for the general register, Mr. Chairman. And therefore, I do request a roll call.
Roll call being requested, there'll be a roll call. Representative Berg, you want to renew your motion as amended? Because we did adopt one amendment at the earlier meeting.
Thank you, Mr. Chair. I will renew my motion as amended to send this to the general register. A few closing remarks. I will just say that there are 12 airports across the nation that use this model. I think you're misunderstanding what the union's welfare fund is for. And as far as saying that somebody controls my livelihood, I've been doing this for 20 years. I've been through mergers and bankruptcies and all the things. And I can tell you that somebody testifying whose suit costs more than the worker that you claim you care about makes in a year, that's a little skewed. So if you care about those workers, as you just said you did, I look forward to your yes vote on the bill. Thank you, Mr. Chair.
So with that, we'll take the roll on House File 4818.
Chair Nelson.
Aye.
Vice Chair Berg.
Aye.
Representative McDonald.
Nay.
Representative Daniels.
Nay.
Representative Greenman.
Aye.
Representative Hill.
Aye.
Representative Hussein.
Aye.
Representative Jordan.
Aye.
Representative Kozlowski is excused. Representative Meckland.
Yay.
Representative Myers.
Myers is a no.
Representative Schultz.
No.
And Representative Wolgamont is excused. There are 6 ayes, 4 noes.
Five.
My mistake, 5 noes.
With 6 ayes and 5 noes, the motion prevails. The bill is on its way. Thank you, Representative Berg.